This is Soul and Sound Healing Notes for Creative Minds. And I created this platform so that we, as musicians and artists and people, can really discuss the importance of mental health and physical health, whole health. And yeah, I think that's good enough. We're gonna get started. Please help me welcome the wonderful Dr. Danielle Johnson.
Hi, good afternoon, everyone out there. Hello, Akua.
Hey, Mama, how are you?
I'm doing great. I'm so glad to be here. I'm excited for what you're doing, promoting health and wellness, and my favorite word, holistic wellness,
I
too.
love that.
Yes.
Holism. Come on, let's go.
Yes.
So now that we're here together and in these very, very difficult times, especially, even when it's not difficult, it's important for us to maintain some balance with regards to our mental health. But in these difficult times, as musicians, as artists, I think it's really important for us to have these conversations. Before we jump into it, I'd like for you to introduce yourself. Just give a quick description about who you are and the things that you do for us.
All right. Yeah, so I'm Dr. Danielle Johnson. I'm a licensed clinical professional counselor in Maryland. I'm also a supervisor. I supervise in addictions and mental health. A great deal of my experience comes from addictions, but I'm also practicing in clinical mental health. I'm also teaching some of the areas in addition to addictions that I specialize in are trauma, and I work with mood disorders, a growing number of clients who have OCD, and a lot of issues in the workplace coming up lately. So, yeah.
Yeah, and I'm so glad that you're here with us because this is, it's a growing. I feel like it's a growing challenge for us, mental health in general. It's not getting better.
Right.
um, and the times aren't getting better. So it's time for us to really start discussing some strategies around finding our balance, and that's really my biggest thing. And specifically for artists, specifically for musicians, you know, when do you ask for help? That's the biggest question, right? When do you ask for help? When do you step outside of what your normal activity is to receive more assistance? Because when it gets hard. But I think the most difficult thing for us is knowing when and knowing how
Yes.
to access resources. And as musicians, I always like to say we sit right there at the crossroads, right? Between reality and dreams, between spirit and physical. And so there is going to be you're going to naturally be working to find a balance between those spaces. Um, and in this society, we as artists are very much exploited. And, we're used just to perform, 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 perform. And there often isn't space for us to just find our balance. So, what do you think about that? What are some of your thoughts on that?
Yeah, I mean, I think that's a really good point from a mental health aspect of having to have to live split between different worlds.
Hmm.
And you mentioned some of those, but the way I would describe that as a therapist is having essentially a fractured sense of self.
Mm,
I've heard artists talk about their alter egos,
yeah,
which sounds like, in one sense, and I like to talk about protective factors, how you protect yourself when you're, I guess, Sasha Fierce on stage,
right.
but really behind the scenes, you're more introverted and you prefer to be alone. But that means that you're living with two different selves that kind of have to merge.
Yes.
And so the first thing I like to talk about when we talk about mental health, because most people think about pathology, they think about diagnosis. I like to talk about what you're doing well for yourself. So
Mm,
I like the term physician heal thyself, musician heal thyself.
yeah.
We can take care of ourselves. And so, and as a musician, you have a lot of protective factors. You have music as a life-giving
Yes.
force. You have community. You have doing what you love. You have the sense of esteem and identity by doing what you do and doing what you love.
Hmm.
But with that come quite a bit of risk factors.
Yeah.
Okay. And so you can think of risk factors coming usually from two different sources. Sometimes they merge,
Hmm.
external forces and internal.
Right.
And some of those external forces, and these are kind of generally applicable. Think about loss,
Hmm.
grief, loss,
Hmm.
bereavement, traumatic experiences, isolation,
Right.
financial stressors,
Yeah.
change of environments, cultural stress, environmental stress, racism, imposter
Baby.
syndrome.
I mean, it's so
Okay.
the list goes on. It goes
Yes.
on,
Yes.
and so you called those internal or external factors.
I would call those external
Okay.
risk factors.
Okay.
Yes.
Okay.
Okay.
And so, as you know, some of my shorts that I've done, the reels that I've done, I kind of tackle very lightly on some of those risk
Yes.
factors. Dealing with difficult personalities. Because what we do is not just perform. We manage people. We manage not just ourselves, but we manage bands. We manage personalities and energies. Um,
Yes.
and then you can often get lost in that, right? And there's lots of triggers because if you have those external factors and you have your own trauma, being able to navigate that in a balanced way can be really tricky, right?
Yeah, for sure. Because what your body naturally will do is compartmentalize,
Mm.
especially if you're really good at adapting to certain traumas.
Mm.
So if you've had a lifetime of having to endure difficulties and traumatic stressors, then you're
Mm.
probably really good at compartmentalizing.
Right.
And the way I think of compartmentalizing is think of maybe a crock pot or an Instapot. There's a lot of pressure and eventually the valve is going to have to be released
Mm.
from that pressure cooker.
Real talk. And then you get the crash out, right? You get the
Yeah.
crash out, the blackout, and people are like, "Whoa, what is wrong with you?" And I
Yes.
think I tackled that in one of my reels where I was like, if you crash out on people, people don't see what the impetus was, what caused the crash out,
Yes.
right? Like people's behavior and situations, and then your own stressors come into play with that. So, like, how do you prepare yourself? Because we're going to have those moments where you can blow up.
Yes.
What Go ahead.
And I think this kind of jumping forward, this has to do with why you're doing this with
Mhm.
um, talking about help seeking. When do we ask for help?
Yes.
And so, one way, because if you compartmentalize well, if you're compartmentalizing those external factors really well, then there may be little signs that you're
Mm.
starting to kind of tip over before the
Mm.
crash out
Right.
actually happens. And so when you have a source, and they don't always have to be professional, but when you have some sort of life giving like a real person source in your life to release the valve a little bit,
Yeah.
that's usually where you can start to see, like I'm kind of getting to be at my breaking point. I tend
Mhm.
to get most of my clients because other people in their lives recommended that they come in for therapy,
Smart.
right?
Okay.
So,
No,
okay.
and that's important to have a solid support system, not just yes men, but people who will challenge you, maybe sweetly, but they'll challenge whatever you think your reality is. Like, well, wait a second, let's look at it from this perspective. And I know I have folks who be like, "Girl, when's the last time you talked to your therapist?"
Yes, you need that person. And you need people to be real with you.
Yeah.
I never recommend listeners or caregivers or loved ones to act like a therapist. You need
Mhm.
to be real with people and
Right.
say, I can't. I got you, but I can't help you with this. I can't tell
Mhm.
you what to do. Or you know you've exhausted my support in this way.
Mhm.
And you get to decide, and we can talk a little bit, I think, about what care you can receive. It
Yeah.
doesn't always have to be a therapist.
Okay.
So the other thing I would also want to mention, because those are external factors and they're really easy to see, they're easy to spot.
Right.
We're really good at looking at pressures that are outside of us.
Right.
But I'm just going to just kind of go off a list really quickly of internal factors, and
Absolutely.
those are the where the blind spots are, right?
Yes.
Okay. So internal factors would be, and of course, the more you have these, the more the stress will kind of weigh down on you.
Right.
So physical health related issues,
Hmm.
known and unknown. And
Okay.
just by the way, diabetes is a major contributor to mental health related
Mm.
symptoms, and people oftentimes live for 20 years with the precursors of diabetes before they actually get diabetes. So just
Wow.
something to keep in mind.
Wow.
Uh, then we also have genetic factors,
Yes.
personality disorders, genetic predispositions,
I'm
family
snapping. I'm
characteristics.
snapping because I need to with some folks.
I know this is one that you're really passionate about, Akua, and generational trauma. That is it's a real thing.
Yes,
So,
yes, yes. And I struggle with this because I think a lot of people are hesitant to work with therapists because they don't want to be diagnosed, right?
mhm,
They don't
mhm,
want to be labeled whatever with whatever mental illness is out there, whatever might apply to them. They don't want to be labeled with a personality disorder. But
yeah,
the reality is, if you can put a name to it, you can find more solutions to it. At least you can start.
that's
Um,
right.
but so what do you say to people who are in that space? Well, I don't want to be diagnosed. I don't want to be put in a box. And I also don't want this to be tracked for a potential job that I might have.
Okay. Well, you have options. You have options. And I always I go with what a doctor might say about diagnosis. I think about the risk versus the reward.
Mm,
So if you're getting a lot of feedback that could possibly point to a particular diagnosis and it's impacting your ability to hold a job, to
hmm.
have healthy relationships,
Yeah.
um, and you just notice it's becoming a burden, then you'd be better off getting the diagnosis and getting help
Right.
rather than running from it.
Hmm.
Um, but I understand that this push to diagnose and a push to label, depending on the type of insurance you have and the type of job
Right.
you have, you
Right.
may want to kind of circumvent that. And you can circumvent diagnosis, especially if it could be a threat to your job, employment, by seeing a practitioner who does not use insurance, like they
Mm,
take self-pay. Self-pay
gotcha.
may be more expensive, but they oftentimes operate on sliding scales.
Hmm.
So
That's true.
if you can kind of maybe show evidence of financial hardship, then they can probably decrease the rate. But that's oftentimes why people opt for self-pay,
Okay.
because insurance is really the main entity that's requesting that diagnosis.
That is that is really good information to have. That's
Okay.
really good information to have. But also, is it possible when you work with a therapist to say, "Listen, I hear you with the diagnosis,
Mhm.
but I do not want that written down." Is that an option, or like I don't want that shared outside of this space?
If you don't want the diagnosis shared, it depends. It depends. That's
Mhm.
a really good question. And I think what in my practice, we are usually aiming for the least stigmatizing diagnosis.
Yeah.
So and we're really kind of trained to exercise caution when certain diagnosis could come with a bit of stigma.
Mm.
We're trained to kind of really mostly focus on this presenting symptoms.
Okay.
So presenting symptoms tend to look like, general anxiety, major depressive disorder, or some variation of depression.
Mm.
And if we find that we're mostly working with those issues, then we keep our focus there. Now,
Okay.
if we know that a client has a more stigmatizing diagnosis, my I guess my rule of thumb is, let's just focus on the symptoms. But if you start to notice that you need medication,
Yeah. You need that diagnosis.
you're gonna
Yeah.
need you're not only gonna need the diagnosis, but the psychiatrist
Right.
or the medical doctor will
Absolutely.
just have to diagnose you. So
Absolutely. Absolutely.
yes, yes.
And I think this is I didn't want to stay too long on that, but I do want to jump into um the family dynamic, like
Mm,
the genetic or environmental dynamic, where is that a thing? I knew my auntie or my great aunt had these highs and lows. My auntie or my uncle had to be hospitalized for something, but in the Black community in particular, it's
okay.
a lot of secrecy around mental health. It's not a conversation. It's a power through kind of situation.
Yes.
And we've been in this country in particular. This is over 400 years of trauma. That is something that is very significant, and to me, it's impossible to separate the mental disturbance that happens from that kind of trauma for generations to now, like, oh, no, sleep is not happening. So what, step into where you are now. Like, what are your thoughts on that, and how do we actually deal with what that really is?
Okay. Okay. So, two things. We're kind of more immediate genetic predisposition
Yeah.
to certain disorders, and that may or may not be the case. And so, because we can't necessarily test, there's no test that says,
Mhm.
like a BRCA test that says, okay, you're genetically predisposed
That's
to
right. Yeah.
breast cancer. We can't 100% see that
Right,
for
right, right.
other things that you may have heard about, like ADHD or
Okay.
bipolar disorder or schizophrenia,
Mhm.
because we're also noticing that another more important factor is called epigenetics. So
Mm.
epigenetics would be genetic. A kind of more of a genetic expression that's as a result of what you're putting in your body, what you're
Mm.
around, what you do
Okay.
with your body. And so this means that, and this is an example that's, I think, kind of rooted in evidence. A person could be genetically predisposed to,
Yeah.
I don't know, I'm struggling with that
That's
word
it, that's
today,
it.
to,
Brainstorm. You got it.
to schizophrenia. Okay.
Mhm, right.
And they may never, even if they have a genetic predisposition to
Mhm.
schizophrenia, they may never express it. But
Mm.
if they, and this is again, the evidence points to this, that if they use a certain drug, especially at a certain age, it
Ah,
could turn that on. It
gotcha.
could
Yeah.
turn on what probably would have never happened or would have
Mhm.
happened later in life earlier.
Gotcha.
The reverse is true for things that you could show or express,
Mhm.
but because of the way you take care of yourself,
Okay.
exercise, diet,
Yeah.
nutrition, you don't ever express
Right.
that disease or concern.
Gotcha.
So it really pays. So what do we do? It really pays to be in tune with wellness, because wellness uh, is also prevention.
Yeah,
Um,
absolutely.
so there we go with that.
Yeah,
N
but that also connects the physical and the mental, health. It's connected. You cannot separate the 2. We can
Right.
see the physical a whole lot more, but the mental is still there. And I think what you were saying about diabetes, and I'm sure other diseases cause all kinds of mental imbalances. Um, yeah,
Oh, absolutely. I mean, not even, disease, but thinking about, vitamin D.
right,
Um, Vitamin D, if you have lower vitamin D levels, then you're more likely to struggle with symptoms of depression, and
right.
we know that, for melanated people in this part of the world, between the
Mhm.
months of October and April, we're not absorbing as much vitamin D from
Ooh,
the
it's so
sun.
real. It's so real.
So,
It's
our
so real.
vitamin D levels will drop, which is why so many of us talk about, feeling a little bit more sad or a little bit more blue in the winter months. It's not just because it's cold, but it
Right.
could be because our vitamin D levels are lower. So
So
it's a good point.
and I also wanna, because I am a Black woman who is 46 years old, and this perimenopause and
Okay.
menopause, it's real. It's so real. And then God forbid, well, what happens is life happens anyway, regardless
Right.
of what your body is doing. So on top of that, Like we have all of these other, and this is a whole nother show, right? Perimenopause, menopause. That's a whole nother. We're gonna get to that. But I just wanted to throw that in there because that's another. Is that internal or is that external or both? What would you say?
Yeah, I would say that if we're talking about hormonal
Mhm.
dysregulation, that we're talking about more internal primarily. We're probably going to have to talk about maybe a spectrum of this internal
Yeah,
external,
yeah,
because we also have to start talking about the way people are treated. Women are treated when it comes to perimenopause. For
mhm.
years, they were denying
Right.
women medication, and now there's the external factor
And I
there.
love it. I
Of
love
Mhm,
all of the discussions, all of the
mhm.
jokes. I feel so connected with so many women around the world because we are
Yes.
talking about this. Like,
Yes.
this is real. It's real.
Yes.
And it's healthy to talk about it so you can actually deal with it. Because if you don't talk about it, you don't find a way to deal with it.
Absolutely,
Um,
absolutely, and I also would not neglect kind of the younger generation, the other side
right.
of the perimenopause discussion, are the amount of clients that I see who have uh, premenstrual dysmorphic
Yes.
disorder.
Mm,
So a lot of mental health related concerns were also linking back to that,
okay.
and they weren't necessarily being treated
Mm,
for the condition, or and treatment. I'm not. I shouldn't say that this is treatment, but a possible response when a person is struggling with PMDD is to get them on a nice healthy level of B complex vitamins.
mm,
So
mm,
I've had clients before who had really good OBGYNs, and they
mm,
said, "Let me get you started on B complex vitamins." They
mm.
got off of the medication and out of therapy because their symptoms of depression or anxiety were resolved.
Wow, that's
Yep.
amazing.
Mhm.
Now, to balance that out, because I'm all about balance, right? Men, I think men have the
Mhm.
hardest time talking about this. Both
Yeah.
physical and mental health, just really and seeking help. Like, what are some things that you could say to our men out here who are
Oh
struggling,
my
but
gosh.
they don't because they're supposed to be strong, so they don't reach out, they don't say anything.
Yes, absolutely, and not only that, I mean, when you said with men, it was like, oh, my
Right,
heart
right,
broke
your heart
because
broke.
yes, because in so many spheres of society, the expectations kind of, um, they dominate the way that they respond to their own internal stressors and to
Mm,
external stressors.
yeah,
So, um, men and this is just kind of an interesting point here, that when men tend to feel sadness, like deep level sadness, it's often expressed by with anger.
mhm, mhm,
And I think it's
yeah,
probably because, like, think about how we're socialized. We react the way that we're treated. And so if anger is the way that people
yeah,
listen to you, so
right,
that means that you don't really get to sit and be sad, and let that be okay.
that's
Okay to
right,
be sad.
that's right,
Um, so, yeah, so there really could be a kind of a more kind of like refined topic on help
yeah,
seeking behaviors with men who are, or artists who are
mhm.
musicians,
Yeah,
who are
and I
men. Yeah.
and I will say because in as a musician and as a band leader, it's dominated by men.
Mhm. Right.
And so I'm constantly seeing men and their behavior and their difficulties and all of that stuff. So there's a space where I feel very empathic about it. If I'm not triggered, right? I can I
Yes.
can remove myself and say, oh,
Yes.
wait a minute. You are really dealing with something. And let me just give you your space and your moment. But so yes, it's a very male dominated space. But again, it's also very macho man energy. You cannot express but so much. Like when you get on stage, you express. But then the
Mm,
question is when you get off stage, how do you find your balance? So I kind of want to jump into that because we're already 25 minutes in, and I knew this was going to be a good conversation. But I want to give some strategies, some takeaways for folks, men, women, non-binary, everybody, every earthling needs to have a way of accessing. health, and to be empowered to know that they can access help. And what does that look like? What are some of your suggestions in terms of looking for research sources to find that balance?
Yeah, I'd probably just go to the reality of the way that we tend to think.
Mm,
And so I'd probably say the first go to, maybe for a certain demographic. I think for younger people, they're probably a little bit more comfortable with
yeah,
accessing care,
I
more
would say so.
knowledgeable about
Yeah.
what's available.
Mhm.
But I'd probably just say, your first line of defense really should be having healthy people, having at least one
Mm,
healthy person in
yeah,
your circle.
yeah,
Because you can have a therapist, you could have a psychologist, a doctor, a spiritual leader. But once that relationship has expired, then who do you have? And
right.
so have at least one healthy person who's non paid in your circle.
Yes. Okay.
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 Um, yeah. So then I'd probably say beyond that, if you realize you need a caregiver, that recognizing that there are a lot of different types of caregivers, especially
Mhm.
nowadays where we have coaches
Yeah.
who work on very specific issues related to career and
Mhm.
certain types of career, certain types of issues,
Right.
relational coaches, all types, spiritual leaders, healers, indigenous healers. There,
Mhm.
there are a lot of different types of caregivers that one can have. And so it doesn't always have to be a therapist. We can maybe talk a little bit more when we expand the discussion about different types of providers, what the difference is
Yeah.
between a coach, a therapist, a psychologist, a psychiatrist.
Mhm.
That's probably something different. But just know that if you're older, get a young person, maybe I guess to show you how to access all these people because
Right.
it's usually going to be online.
Yes. Yes.
Okay, and also know that if you do if you decide to go the professional route, that there you might have a lot of duds. I have quite a few clients who
That
talk about
part.
I had a lot of different counselors and
Yeah.
they were awful or they left. So you have to be patient with because the more you have out there, the more duds you might find.
Oh my God. And I will say that is so true. And that's for anybody who's going to help you, right? If you find a good doctor, you are in the game. But there
Yes.
are so many terrible ones, right?
Yeah.
For physical health, but definitely mental health. So
Mhm.
you got to shop around. You got to check some spaces out. And just to, real quick, check out the information in the description and have some links that you can connect to. You can connect directly to Dr. Danielle Johnson. And then I know for me, it was finding something that was outside of my profession as a teacher and as a musician that grounded me. Gardening has become a beautiful escape for me.
Yes.
And just connecting to Mother Earth and honoring Mother Earth and learning those lessons and putting my bare feet on the ground and
Yes.
reconnecting as an earthling, that it's a way of dispersing that imbalanced energy so that you can find some perspective. And I hate to say it, but putting the phone down.
Yeah, that's a hard one. That's a
It's
hard one.
hard.
Yeah, it
It's
is hard.
hard.
Yeah. I mean, you not only do you get like the dopamine hit of
Right.
having it, but I'd also just say, let's be honest, if you're finding yourself scrolling on social media, it's also about connection. So
Yeah.
think about what you're getting from this and before you put it down, I guess, because you're going to probably feel a lot of shame if you put it down and then pick it right back up,
Yeah.
but also thinking about what
Yeah.
you're going to replace it with is what I tend to tell my clients.
Yeah, I love that. I do love that. So we're gonna wrap it up. This has been a solid 30 minutes, and this has been fantastic.
Yes.
Danielle, I really appreciate you being here and your energy. I have to do a shameless plug of my candles.
Oh.
Hello, Desi Soul in the house.
Oh,
I have to I
beautiful.
have to send these to you. So this is part of my gardening part as I use the herbs and the flowers in my garden to add to my candles.
Oh, that's lovely.
Yeah, and I mean, I think it's just important for us to find a pastime that's different from our everyday grind and hustle. Um,
Yes.
and in a later show, I do want to touch on, and you talked about it a little bit, the how artists a lot of times we're these people on stage, hey, 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 but then most of the artists I know are actually introverted.
Yes.
And I think it's super, super important for us to know the difference between being introverted and needing our battery to be recharged and actual depression.
Yes, that's good. That's good.
And I think we're going to talk about that later, but I just wanted to drop that because it's deep, it's real, and the darker it gets, the further away from the sun we get, the more intentional we have to be about finding our healing spaces.
That's right.
So, real quick, do you have any takeaways you want people to walk away with from today?
Yeah, I really just want to kind of emphasize the last point there when you were asking about how do you care for yourself. I mentioned your support system, your
Mhm,
community who you surround yourself with, help
mhm.
seeking, different ways of accessing care, but also really investing in caring for yourself well. And there are hobbies, there are interests, but there are also just basic things.
Yeah,
So sleep, getting deep, restful sleep,
big time.
what you're putting into your body,
Right.
um, your kind of biomedical care,
Hmm.
attending to any issues that you may have. Make sure you're regular with knowing what your blood work, what's going on with your blood work,
Yes.
um, because if you're not attending to those basics of care,
Hmm.
then it really doesn't matter how much therapy you get. Medications obviously doesn't matter what medications you're putting in your body,
Hmm.
or how well the medications that you're probably treating yourself with. None of those things matter if you're working with a broken system and you're not really aware of it. So that would probably say, and you could probably go to any website to look up self care, dimensions of self care,
Mhm.
creating a good plan for caring for yourself well. So that would probably be the one thing I really want to kind of emphasize.
Okay.
Yeah.
Well, this has been fantastic. I know we are on Instagram right now. We're on Facebook, and I believe we're on YouTube. I need y'all to be patient with me because I'm just learning this, and Danielle is learning this with me. Um,
Yes.
this this streaming live thing, and we're gonna try and do it. We're gonna do it again, and we're gonna keep doing this so that we can reach as many people as possible. But y'all check out the descriptions. I've got some really cool information in there. Check out Dr. Danielle Johnson. She's on Headway. Reach out to her. She also has her email address in there. There's also a resource that my husband introduced me to by Tricia Hersey, Rest is Resistance. And I have that link. You can check her out on Amazon. I love it. It's fantastic. And I have my candles. I just placed them in a small boutique in Mount Rainier, Maryland, called Astley Pure Boutique. And they have a lot of amazing things there. A lot of artisans have their things being sold there. And there's a couch, and you can just sit down and smell all the scents. And, that's another thing, just really connecting to community in an organic way. Just go. You ain't got to be gigging to find some sweetness, right? To
Yes.
get good attention. Go outside, walk on the earth. You don't always have to socialize, because I know me. When I come home, I come home.
Shut it down.
I shut down. I am no longer performing. I am mommy. I am me. I am wife. Like the whole thing. But just y'all check out the links in the description, and we'll be back soon, right, Danielle?
Yes, I'm looking forward to it. I love this. I love the discussion about wellness and merging different
Yay.
worlds into wellness. So thank you so much for having me.
Okay, before we go, I do have to I have to play with this little button here. I got a
Okay.
comment. Oh, that's from my daughter. This is an amazing life. Thank you, Boo. And she did another one because she's awesome. Where's the other one? Oh, learning so much. Oh, I just love this. This is so cool. So we'll be back. We're gonna have all kinds of cool things up here, and more people. And again, women, men, girls, boys, non-binary folks, y'all reach out to people who you can connect with. Again, this has been Soul and Sound, Healing Notes for Creative Minds. I'm Akua Allrich, and today we're featuring the awesome Dr. Danielle Johnson. Y'all take care of yourselves. Peace, love, and light. Bye-bye.